Welcome to HealthBloom Channel, where we share trusted insights into health, medicine, and modern treatments to help you live stronger, longer, and with more confidence. If you care about your well-being or want to stay informed about breakthrough medical solutions, you're in the right place. Have you ever found yourself waking up in the middle of the night, not once, not twice, but 3 or 4 times, desperate to urinate yet barely able to go? Or maybe you sit down at dinner with your family, only to excuse yourself again and again because the urge to urinate just won't stop. For many men, this becomes a silent, frustrating struggle. The bladder never feels fully empty. The stream of urine is weak, sometimes starting and stopping, sometimes just a dribble. And all of this can create a constant background of exhaustion, embarrassment, and even fear that life will never feel normal again. These are the hallmark symptoms of an enlarged prostate, also called Benign Prostatic Hyperplasia, or BPH. The prostate is a small gland that sits just below the bladder and surrounds the urethra, the passageway that carries urine out of the body. As men get older, the prostate often grows larger. At first, the change may go unnoticed, but over time, as the gland swells, it squeezes the urethra like a tight clamp on a hose, narrowing the passage and making urination more and more difficult. The result? Nights broken by endless trips to the bathroom, days filled with the anxiety of searching for the nearest restroom, the frustration of weak flow, incomplete emptying, and the feeling that life is being controlled by your bladder. And beyond the inconvenience, these symptoms can have real consequences. Disturbed sleep leads to fatigue, poor concentration, and irritability. Untreated, an enlarged prostate can also cause bladder damage, urinary tract infections, or even kidney problems. But here's the good news. Modern medicine has developed treatments designed to relieve these symptoms and give men back their comfort, their confidence, and their independence. One of the most innovative and patient-friendly of these treatments is called the Prostatic Urethral Lift, often referred to as the stapling procedure. So what exactly is it? Imagine your urethra as a narrow tunnel that's been crowded by thick, bulging walls of prostate tissue. Instead of cutting away that tissue with surgery or burning it with a laser, the prostatic urethral lift takes a gentler, more mechanical approach. Surgeons place tiny permanent implants, like miniature staples, through the prostate. These staples act almost like curtain hooks. They pull the obstructing tissue to the side and hold it there, instantly widening the passage. With the tissue no longer blocking the tunnel, urine can flow more freely again. The benefits of this approach are clear. First, it is minimally invasive. The entire procedure is performed through the natural urinary passageway, with no large cuts or incisions. Because no tissue is destroyed, there is typically less irritation, less bleeding, and a quicker recovery compared to traditional methods. Many men are able to go home the same day. Second, improvement is often immediate. Patients frequently notice a stronger urine stream and a reduced urge to go within days, sometimes even hours after the procedure. The bladder finally begins to empty properly, and nights of broken sleep become nights of uninterrupted rest. Third, the prostatic urethral lift tends to have a lower risk of sexual side effects. One of the greatest concerns men have about prostate surgery is the possibility of erectile dysfunction or loss of ejaculation. Because the stapling procedure does not cut or burn tissue near critical nerves, these complications are much less common. For men who value both urinary comfort and sexual health, this can be a very important advantage. Of course, no treatment is perfect. The prostatic urethral lift does have its limitations. Over time, just like curtains that may sag again, the prostate can continue to grow. This means the implants may not hold the tissue back forever, and some patients may need additional treatment after several years. It also isn't suitable for men with very large prostates, where more aggressive treatment may be necessary. Still, for the right patient, the stapling procedure can be a life-changing solution. It offers rapid relief, minimal downtime, and preserves quality of life in ways that older surgical techniques often could not. It's a procedure designed for the modern man who doesn't want his days and nights dictated by constant trips to the bathroom. So if you or someone you care about is living with the frustrating symptoms of an enlarged prostate, nighttime awakenings, weak flow, urgency, and exhaustion, know that options exist. Talk to a urologist and ask whether the prostatic urethral lift could be right for you. Relief is possible. Life doesn't have to be ruled by your bladder. With treatments like the stapling procedure, men around the world are reclaiming their freedom, their sleep, and their peace of mind. And that's something worth considering. If you found this video informative, give it a like, subscribe to HealthBloom Channel, and hit the notification bell so you never miss our health insights. In the next video, we'll dive into another fascinating treatment: green light laser vaporization, where precision light burns away prostate tissue to restore flow. Stay tuned.